Good afternoon, everyone, judges and all the audience here. My topic for today is sleep deprivation and its impact on the quality of vision. So as we all know, what exactly is sleep deprivation? If a person is not having a good 8 hours of sleep, it's called sleep deprivation. It can either be acute or chronic. Acute is usually a couple of days, and chronic when it's prolonged over a period of time. Now, what happens to your brain when your brain doesn't sleep? You have hallucinations, false memories, you have poor decisions that you make, risky decisions that you take. And this has been well published also. We also know it has sleep deprivation has an effect on health, blood pressure, hypertension, diabetes, on mood swings, and also on performance. So we want to study through this study could sleep deprivation lead to a poor ocular surface and in turn also poor optical quality? So the purpose of our study is to elucidate the effect of sleep deprivation on our ocular surface. The materials and methods, it's a prospective interventional study in which 30 subjects and 60 eyes were studied. The inclusion and the exclusion criteria has here been noted. So what we did is that the healthy volunteers that are postgraduates and fellows from our institution were included in the study. First, the tests were done at baseline. At baseline, we gave them a watch, a smart watch which could record their whole sleep cycle. After 24 hours of no sleep, that is sleep deprivation when they were on call, etc., we did the tests after sleep deprivation, and the tests were done again after 3 days of good sleep. Now what are the tests that we did for the patients? Were the dry eye evaluations, that's the Schirmer's tear breakup time and the ocular surface disease index. We also took the Schirmer strips so that we could measure the cytokine levels from the ocular surface and sent it to our lab, where what we did is we stored it, extracted the tears, ran it through a flow cytometer, and we could find out which were the different cytokines which were present in the ocular surface. We also did an optical quality and a tear film analysis using the OCAS HD analyzer, and we found out the mean OSI and the vision breakup time, which is the time taken for the vision to break up. So after how many seconds does the vision quality decrease? We saw the lipid layer thickness using the LipiView interferometer, and by which we could get the optical quality again. So what were the results of our study? The Schirmer's test we saw at baseline was around about 21, which dropped down to 12 and increased to 20 after a period of good sleep. Similarly, in tear breakup time, the baseline for the patients was 7.14, which again dropped down to 5.91, and it increased back to 6.82 after good sleep. Similar findings were also found on the OSDI questionnaire. The tear film analysis was 0.86, which increased to 2, so we can see how much scatter the patient has, and after good sleep the scatter decreases again. And similarly for the vision breakup time, we can see how the optical quality degrades after poor sleep but improves well after good sleep. The lipid layer thickness, which was usually 82 in a baseline, dropped down to 71 after sleep deprivation, and on good sleep it returned back to 83. The cytokines that we extracted were studied, and we found an increase in interleukin 1, 6, TNF alpha, MMP9, etc., which again decreased back to almost near normal levels after a good period of 3 days of sleep. So what is the conclusion of our study? So we saw that the Schirmer's and all the other ocular surface tests, the lipid layer tests, the OSI, and the cytokines all led to a poor optical quality. So what new does this study add? 1. Sleep deprivation causes altered ocular surface. 2. An altered ocular surface leads to decreased optical quality. 3. Sleep deprivation causes an increase in the ocular inflammatory factors. And 4. That even 3 days of good sleep is not sufficient enough for the ocular surface to return to normal. So we saw that not all the variables were coming back to normal even after 3 days of good sleep. So we know that the cytokines that we studied, like interleukin 1 and 6, increased levels of that could cause a progression of keratoconus. We also know that increased levels of MMP9 causes dry eye disease. It's already been published that raised interleukins and TNF alpha also lead to AION. It's also known that high levels of cytokines are seen in conditions like depression, and also increased cytokines and chemokines are risk factors for conditions like diabetic retinopathy and CRVO. So how do we translate our study to the clinics? We all know that the millennial generation right now, addicted to their phones, and long working hours, have very few hours of sleep. These are more prone to all the neurological and ophthalmic conditions. Therefore, a history of sleep deprivation is very important in them. Two, people with prolonged periods of driving, like truck drivers and pilots, and have prolonged hours of awakeness lead to a poor optical quality, and in turn will lead to a poor job performance. And we can also guide neurologists to provide lubricant eye drops to chronically sleep deprived patients. What were the limitations of our study? The study was only performed on healthy individuals, and only the acute sleep deprivation was considered. And the volunteers, the good sleep when they were at home, but the 3 days of good sleep, not all of them had a watch, so the sleep could not be charted. And finally, the futuristic approach, what we want to study is to see how many actual number of days it takes for the ocular surface to return to normal after a period of sleep deprivation. If we could find out any drops which are particularly going to act on the inflammatory factors so that they can help the ocular surface, and what is the effect of this sleep deprivation on ophthalmic surgeons. Thank you. One was a baseline for all the patients, one was after they were 24 hours of sleep deprived, and once after 3 days of good sleep. So it was done, all the tests were done at 3 time points. Also, we are routinely using all the tests that are being done, like the Schirmer's test, the tear breakup time, the lippy view, and the OSI. We're regularly doing it as a part of our dry eye workup, in which we've also studied and published the repeatability of the tests, so that when we're doing it, for example, if we're doing a lippy view, when we repeat it 3 times, we're getting repeatable results in that when we're doing it for 3 times. So it's not that when one time that is causing the variation between the results.
Sleep deprivation 24 hours, they were not.
Yes, sir. So these were the volunteers which we took. We obviously, the ethics committee did not allow us to do it on randomly on patients, depriving them of sleep. So that's why we took the volunteers.
Allowed on residents, huh?
It was a part of the job, sir.
So you're letting NN secrets out of what happens in residency, yeah.
So it's basically the postgraduates and the fellows who were on call. They were usually, because they were awake for 24, they were awake throughout the night and on duty. Those who were going for enucleation calls, etc., and were awake throughout the night. And we also validated whether they were actually awake or not by giving them a smartwatch, and we saw their sleep cycle. That is why we actually gave them a smartwatch to see whether they were actually sleep deprived, or sometimes, on call, whether they were catching a couple of hours of sleep. So the point that we gave them the sleep watch was just to validate whether they actually were sleep deprived or not.
And other suggestion is that this would have been an ideal paper for cornea, ocular surface, because a lot of effect that you have seen is on the ocular surface.
So it was a good study.
Thank you, sir.
Just I want to know what it could be lead to, because like in dementia and all, I mean, in depression, they also have sleep deprivation.
Yes.
So is it the sleep deprivation which causes dementia, or dementia causes sleep deprivation?
So basically, it's a vicious cycle, sir. So what happens is that we've seen that as I said, this is done only on acute sleep deprivation, and in just acute sleep deprivation, which is just 1 hour of sleep deprivation, we've seen that the cytokine levels and the inflammatory factors of the ocular surface are so highly raised. Now, if we consider a patient who's chronically sleep deprived, we can just multiply that by a particular factor and imagine how much more it's going to affect, how raised these cytokines and these factors are going to be, which can drive diseases like dementia and all that. But like you said, sir, it's also very much possible that patient who has dementia would automatically again lead to sleep deprivation. So it's like a vicious cycle. It just adds up and...
So sleep deprivation may be the starting point, and that may lead to